Our mission, vision, and values were developed in 2009 through an inclusive and consultative strategic planning process. Our mission, we create exemplary healthcare experiences for patients and families every time, compels us to continually strive for patient and family satisfaction, high employee and physician engagement, and constant performance improvement. We have 5 strategic themes: quality care, exceptional relationships, outstanding performance, inspired people, and culture of innovation. We are currently embarking on the next 3-year cycle of strategic planning. The board has endorsed that these 5 strategic themes remain the same for the coming 3 years, as will our mission, vision, and values. However, we will undertake an internal and external process of consultation to redraft the priorities and goals under each of these themes. The 7-month strategic planning process will allow us to consider and assess the changing healthcare landscape in the province of Ontario, the government and the LHIN's strategic plans and priorities, new models of care delivery, and new partnership with health service providers in the community. We will ask ourselves and others, what are the top must-do, can't-fail priorities for Bluewater Health? The constant through all of this change is our endless pursuit of excellence, of quality patient and family-centered care that you depend on and trust. Our operating budget is approximately $180 million, about 75% of which comes from the Ministry of Health and Long-Term Care. The remainder of our funding needs must be self-generated through revenue such as preferred accommodation and parking fees. We are responsible for the hospital here in Sarnia and the Charlotte Eleanor Engelhart Hospital of Bluewater Health in Petrolia. Collectively, we currently have 326 inpatient beds and are designated by the ministry as a community hospital. That's different from a tertiary hospital or academic hospital. Together, we offer a full array of specialized acute, complex continuing care, rehabilitation, allied health, and ambulatory care services. The types of services we offer at our hospitals and the volumes of service we can offer are negotiated with the Erie St. Clair LHIN and prescribed in what's called a Hospital Services Accountability Agreement. Close to 2,500 staff, professional staff, and volunteers work here. This makes us the largest public sector employer in the community. 93% are our employees of one of 3 unions, while 7% are non-unionized employees. Almost 70% of our operating budget is staffing. The average age of our employee is 46 years old. Our turnover rate is low. Some of our workers have been with us for 10, 20, 30, or even 40 or more years. Our website provides information on current employment and volunteer opportunities. Last year, we cared for over 12,000 inpatients. We had over 85,600 visits to our emergency rooms. Our operating rooms performed almost 11,200 surgical procedures. There were 8,150 dialysis treatments and more than 34,200 ambulatory care visits. 1,022 babies were born at Bluewater Health last year. Every one of these statistics is higher than the year before, but while the need for our services is growing, funding is not. With Ontario's deficit reduction plan, hospital budgets are being reduced, no longer keeping pace with inflation, centrally negotiated labor contracts, and rising technology, supply, and utility costs. Hospitals have a difficult time ahead. The challenge is to ensure that the right care is provided at the right time, by the right provider, in the right setting. The status quo for hospitals in Ontario is not sustainable. That's why our strategic planning process to guide our priorities for the coming 3 years is so timely and so important. Our strategic planning process is just one of the responsibilities of our volunteer board of directors. Their work also includes quality and performance monitoring, financial oversight, risk identification and oversight, stakeholder communication, engagement and accountability, and legislative compliance. The board role is governance, not operations. Regarding the board composition, we publicly advertised in the spring for board positions. Applications are evaluated by the board's Governance and Nominating Committee, which interviews qualified applicants and makes recommendation to the corporate membership. We look for a broad range of skills necessary for effective governance, and we utilize the Ontario Hospital Association's Guide for Good Governance. The board meets monthly, either in Sarnia or Petrolia. Board meeting packages, minutes, presentations, reports, and policies are publicly available on our website. Just like businesses and industries, there's so very much that we're proud of at Bluewater Health, yet sometimes it's difficult to get the good news out. So forgive me for a moment while we toot our own horn. Last year, we earned the highest honor possible from Accreditation Canada. The designation is called Accreditation with Exemplary Standing and means that we achieved or exceeded almost 1,900 nationally required standards. Accreditation is a voluntary process which we undertake every 3 years. Last year, we also earned the Chamber of Commerce Outstanding Business Award in the environmental category. We've earned 3 international awards for communication excellence in the past 2 years. The Ontario Hospital Association honored us with a Quality Healthy Workplace Award in recognition of our workplace culture, continuing education, and employee health and safety results. And in October, our stroke care was selected to be featured at the National Stroke Congress. Many of these honors are displayed in our trophy case near the front lobby. Just as important to us is what our patients and families tell us. Our satisfaction rate, monitored each quarter through random, anonymous surveys, typically rates us as higher than the provincial average. Cards, letters, donations to our foundations, and stories shared with our staff, patient advocate, and our board help us to know we're doing many of the right things. Our results are something that we believe you're welcome to know about. Whether we've hit a provincial performance target or missed the mark on one of our own goals, we are transparent about our results. We voluntarily post 20 key performance indicators on our website, more than is required of us by legislation. You can track our progress on hand hygiene, infection rates, wait times, patient satisfaction, and more. Speaking of wait times, ours are shorter than many other hospitals in Ontario, and while our performance is strong, we are constantly striving to get better. Our annual Quality Improvement Plan defines key initiatives to continuously improve patient safety and quality of care. The plan sets and monitors our improvement targets. Speaking of performance, this year we will launch Bluewater Health's Performance and Transformation System. With lean system thinking, engagement of frontline staff, evidence-based best practices, and standardized process to improve the patient and family experience, this system will be at the core of our mission control. We're excited to have been chosen by the Registered Nurses Association of Ontario as a Best Practice Spotlight Organization candidate. That means that we are one of a small group of hospitals in Ontario to have this designation and embark on this work. Over the next 3 years, we will advance RNAO's evidence-based best practice guidelines. The first 2 we will focus on are establishing therapeutic relationships and client-centered care. With the recent arrival of our new patient advocate, we will be recruiting volunteer patient experience advisors. Working with our patient advocate, these advisors will evaluate and comment on our processes and practices from their unique perspective as a patient or family member. Hearing, understanding, addressing, and integrating the wisdom of patients and their families into our day-to-day work is critical to our ability to create exemplary healthcare experiences for patients and families every time. At Bluewater Health, volunteers are involved from the boardroom to the bedside on our advisory panels, auxiliaries, and hospital and foundation special events. They help us to deliver on our mission. Last year, approximately 700 volunteers contributed more than 48,000 hours to Bluewater Health. So far, we've focused on our people and performance, and now it's my pleasure to tell you about our wonderful facilities. Our recent $319 million building and renovation project was Sarnia-Lambton's largest public sector capital construction project. We're pleased and proud to say that we finished it on time and on budget. And we moved into our new and renovated spaces in 2010 and 2011. The site is comprised of 3 connected buildings called London, Russell, or Norman. Here are some behind-the-scenes facts about the facility that make it so unique and special. The Sarnia facility covers roughly 9.5 acres, and our total gross building area is almost 654,000 square feet. 95% of raw materials were harvested, extracted, or recovered within 500 miles of the hospital. 11% of the total building material content was manufactured using recycled materials, and 90% of construction waste was diverted from landfill. With low-flow fixtures and reuse of gray matter, we have reduced our water consumption by 32%. 25% of total water shedding off the building is captured by an underground cistern. The cistern collects rainwater for use in landscaping of our green space and offsets the use of potable water for irrigation. This is just one of our garden spaces, but we have others, including rooftop gardens for heat shedding. 77% of the total roof area consists of an ENERGY STAR rated roofing material, which includes vegetated area. There are 6 garden spaces in all, each with native plants, and 3 with water features. All but 1 are wheelchair accessible. We were pleased to be part of the recent Communities in Bloom adjudication. Judges seemed pretty impressed with our gardens, and we hope we contributed positively to Sarnia-Lambton's Bloom status. All of these energy and conservation features help to make us Ontario's first LEED certified acute care hospital, and one of the few in Canada. LEED stands for Leadership in Energy and Environmental Design. Being leaders in LEED, we were featured on the cover of the Canadian Journal of Green Building and Design. A 6-page feature in a national magazine was a proud moment for us and our community. At the Sarnia facility, we have a retail food court including Coyote Jack's and Tim Hortons. These vendors were selected through an RFP process led by our foundations. Compass Group Canada hires the staff and manages the services, and the foundation benefits from the rental of space. The fresh-made soups, salads, and entrees are popular with patient families, visitors, staff, and neighboring students. We also have a gift shop called Poppy's, operated by the owner of the local bookkeeper. And many folks are not aware that we have an indoor therapy pool and on-site hair care available for patients and public. This hair care service is managed by one of our 3 volunteer auxiliaries. At CEEH of Bluewater Health, where we've just celebrated the 100th year of service, we've made recent facility investments of about $130,000 from donor and grant funding. Improvements included a new boiler chiller, painting, fire pumps, the commemorative Engelhart Garden, and a donor wall to recognize the $655,000 in fundraising gifts to the Pat Mayu Eye Center. Maintaining a public infrastructure like ours 24/7 and 365 days a year on 2 sites is a big responsibility. Sometimes when people think of hospitals, they think only of doctors and nurses, but we also have engineers, technicians, biomedical specialists, maintenance experts, infection control specialists, and housekeepers as full and part-time staff to keep our buildings running. We think they do a terrific job of meeting and exceeding all of the standards that are required, keeping our facilities clean and safe, accessible, and user-friendly. Well, if you haven't heard enough about us or you're curious for more, there are a number of ways you can be informed, involved, and engaged with Bluewater Health. Over the past 3 years, we have worked to evolve our communications and public affairs efforts to be more proactive, transparent, and accountable. We've maximized new opportunities to create a greater public understanding of who we are and what we do, and ways to engage with us. I encourage you to check out our website, www.bluewaterhealth.ca, for information such as news releases, announcements, board meeting dates and packages, board highlights, reports, performance results, and job opportunities. You can tell us how we're doing via the Contact Us button and e-form on our website. We welcome your feedback and suggestions. You can also visit our annual report website, www.healinghappenshere.ca, to see a video from our CEO and board chair, financial statements, statistics, and highlights of our achievements of 2011-2012. We hope you will choose to like us on Facebook. It's where we share health tips, special events, and news with fresh content every weekday. And check out Pulse. That's a quarterly publication in partnership with the Foundation. Pulse shares patient and donor stories and news of our changes in progress. And it has a fresh new design. Pulse comes to homes within the Sarnia Observer and is posted on the hospital and Foundation websites. If any of you are local history buffs, we have a beautifully illustrated and award-winning history book authored by Vic Dudek, available for sale in our Foundation office. On behalf of the Foundations, I want to extend our most sincere appreciation for the support we have received from the Sarnia-Lambton community. This building would not be possible if not for donations totaling more than $46.5 million. There are 2 charitable foundations supporting Bluewater Health: Bluewater Health Foundation and the Charlotte Eleanor Engelhart Hospital Foundation. Together, their goal is to ensure that our hospitals are ideally equipped to do their utmost for the care and well-being of patients. The current campaign in Sarnia is directed towards the new MRI. At CEEH of Bluewater Health, donors have supported such important patient care needs as the new Pat Mayhew Eye Center, where cataract procedures are performed for all of Sarnia-Lambton. Donors can support either foundation by attending a special event, responding to a direct mail appeal, giving online, or naming us in a will, for example. Whatever your decision, we respect your gift-giving choices and will direct your donation to where you ask, or to the greatest priority need. So far, we've shared a bit about who we are and what we do. Have we impressed you? We are proud to showcase our people, programs, facilities, and performance, but we're even more proud that healing happens here. Healthcare is complex, but many of the principles that guide us, customer service, performance, market share, staff satisfaction, are the same that guide business or industry. You may not know that funding follows patients. That means that when someone chooses a London, Windsor, Chatham, or Toronto hospital to receive care, that hospital earns ministry funding. Whenever you can, if we have the specialists here, the services here, and the quality here that you expect, we hope you'll consider us for your healthcare needs.